to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're tackling a difficult but very important topic: what to do when cancer treatment isn't working. This is such a critical discussion because when you or a loved one get the news that treatment isn't going as planned, it can feel, and most always feels, very devastating. But it doesn't mean that you're out of options. In fact, that is exactly when you need to just pause, reassess the situation, and make meaningful choices about your next steps. So joining me today is Christine, a member of our team. Welcome, Christine. How are you doing today?
Hi, Dr. Borrelli. I'm doing great. Thank you so much for having me here.
Of
Um,
course.
yeah, so we are getting a lot of questions actually about this, like in calls, like in comments, and even messages, like private messages in our Facebook, like all of our social medias. Like when we say a treatment isn't working, what are we really talking about?
Yeah, and that's great. That's a great question or questions. It can mean a few things. So maybe the cancer isn't shrinking or responding the way your team hoped. Maybe your symptoms are worsening or side effects are so severe they're affecting your quality of life. Sometimes it's not about failure, it's about the treatment being no longer effective or tolerable. So that moment is really scary because you're kind of thinking, okay, are we stuck? Like, is there options and things like that? But it's also an opportunity to explore new options.
That's absolutely right. So here's a question we get a lot. Is it okay to switch oncologists?
Absolutely. And I've said this, in prior podcasts as well. It's never too late to seek a second or even a third opinion. Sometimes a new provider brings a fresh perspective or has access to different treatments or clinical trials. And even if their recommendation ends up being the same, that's totally okay. That second opinion can give a peace of mind knowing that you're on the right track and that's maybe the best option or only current available option. On the flip side, you might learn something new that changes the course of your treatment for the better, and that's when it gets really exciting because you're reaching new management options that weren't available prior. And let's be real, if your trust in your care team is fading, that's a valid reason to explore other providers. You deserve to feel confident and heard, especially when you're dealing with such a time sensitive and terrible diagnosis.
That's totally right. So now how can patients, go about getting that second opinion?
Great question. It's not always as simple as asking your current oncologist for referral. Some may help, others might not, and maybe it's not going to be the best option for you. And that's where a private patient advocate can really step in. At Pathway Patient Advocates, we help research second opinion options based on your specific diagnosis, location, and treatment history. We also help coordinate appointments, try to get you in the most timely manner possible, gather records, and prepare for the visit, and even attend the visit if you need us to. And it's just a very concise approach because not only do you want to get that appointment, you also want to make sure you're getting the most out of that appointment and getting it in the most timely manner as possible.
Exactly. And we are completely independent, right?
Yes.
We don't work for insurance companies or healthcare systems. So that means we're only focused on what's best for you.
Yes. No, you're right. Exactly.
So once a patient finds out their, current plan isn't working, what's next? Like what options do they typically have?
There is actually many. Depending on the cancer and the person, one consideration could be changing the type of chemotherapy, trying immunotherapy, adding therapy, so combination therapies, perhaps radiation may be a good option, surgery, clinical trials. I mean, the list goes on and on. For some patients, integrative or alternative therapies may be part of the conversation as well. And for others, choosing not to pursue more aggressive treatment options may be the right option as well. And this is really based on personal or quality of life decisions. And so it really needs to be something that's explored in a very non rushed conversation and setting. There's no right or wrong decision, but you really deserve to know all of your choices so that you can make an informed one.
Totally agreed with you with that. So how does a private patient advocate, support someone in this process?
Yeah, that's a great question. So, when your cancer journey takes an unexpected turn, it's very overwhelming. There's fear, confusion, and a lot of decisions that you have to make so fast. And it's like you're kind of stuck. You don't know what to do first. It's also not only overwhelming for the patient, but also like for loved ones as well, like family and friends. So, a private patient advocate is there to take that burden off of your shoulders. We help gather information, review your options with you, communicate with your providers, and make sure that your voice is heard. In addition, we really help prevent medical errors and through this whole fast paced process. You don't have to do it alone. A private patient advocate becomes your second brain, your second set of ears, and strongest supporter, especially in the moments when everything feels very heavy.
That's right. If your treatment isn't working, that's not the end of the story. It's the beginning of a new chapter, one where you advocate for yourself, explore new directions, and take back control of your care.
And we're here to walk that path with you. If you need help finding a second opinion, reviewing treatment options, or navigating next steps, reach out to us at Pathway Patient Advocates. Call us at 947-517-8395. And we're here to talk to you and we want to help.
Amazing. Well, thank you so much, Dr. Borelli. This is a great episode. I'm sure a lot of people or our listeners will, learn a lot from this episode. So, yeah.
Thank you, Christine. It's been a pleasure as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journey. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.